Hello, my name is Dr. Stephen Loyd. I'm the Chief Medical Officer here at City Recovery. I want to speak specifically to our patients who are of childbearing age. One of the things that really bothered me when I first started treating patients with opioid use disorder, particularly women who were of childbearing age, that they were told if they were pregnant and they were on medications containing buprenorphine or methadone, that their babies would not be born dependent. Now, another word for dependent is called NAS, neonatal abstinence syndrome. So basically what patients heard is, if I'm taking Suboxone or I'm taking methadone during my pregnancy, there's no chance my baby will be born dependent. And that is simply not true. There's a very good chance your baby could be born dependent if you get pregnant taking the medication that we use here at Cedar, Suboxone, as well as methadone. The chance of your baby being born dependent has nothing to do with the dose. Now, it makes sense to think, well, if I'm on a lower dose, then my baby has less of a chance of being born dependent. That is simply not true. With that said, we want the lowest effective dose of medication for our patients to prevent cravings and withdrawal symptoms. So while it does not have a bearing on the risk of neonatal abstinence syndrome, we still want the lowest effective dose because it's simply good medicine. Now, with that said, I'm going to cover some principles around prevention of unintended pregnancy. Now, it's important to remember that most of the pregnancies in the United States are unintended to start with. That doesn't matter if you have substance use disorder or not. More than 50% of pregnancies in the United States are unintended. And I am in no way telling you not to get pregnant. If you want to get pregnant and have a baby, can you do that while you're taking medication for your opioid use disorder? Absolutely. Is it safe? Absolutely. But there is a chance your baby could be born dependent. If you're not wanting to get pregnant, then the best plan of action is to prevent that pregnancy. And that's what I want to talk to you about today, is prevention of unintended pregnancy. Now, as I've already said, if you're on medication such as Suboxone or methadone, there is a chance your baby can be born dependent and have neonatal abstinence syndrome no matter the dose you're on. That doesn't mean that you shouldn't take the medication. You're absolutely doing the right thing for yourself, and you're doing the right thing for your baby. It's also very, very important that you follow up with prenatal care. Women who go to prenatal care while undergoing treatment for substance use disorder secondary to opioids have better outcomes than women who don't go to prenatal care before they give birth. So we're talking today about prevention of unintended pregnancy. So my aim is to tell you the different risk of getting pregnant with the different forms of prevention of unintended pregnancy. Everything from condoms and withdrawal method, to permanent solutions such as hysterectomy, tubal ligation, and vasectomy. So with that said, let's get started. I'm going to cover the methods of preventing unintended pregnancy in three categories: least effective, more effective, and most effective, and last but not least, permanent. The least effective methods preventing unintended pregnancy are male and female condoms, the sponge, the withdrawal method, fertility-based awareness, which is basically known as the timing method, where you try to predict the ovulatory cycle and not have sex during that time. And then last but not least, spermicide. These are the least effective ways to prevent unintended pregnancy. 18 out of every 100 couples that try these methods get pregnant during the first year. 18. So it means these methods that I just went over, male and female condom, sponge, withdrawal method, fertility-based awareness, spermicide, fail about 1 in 5 times. The next category for prevention of unintended pregnancy I want to cover is the more effective category. In this categories are injectables, birth control pills, patches, rings, and diaphragms. These more effective methods have an unintended pregnancy rate of about 6 to 12 per 100 women in a year. That means that if 100 couples are using one of these methods, injectables, birth control pills, patch, rings, or diaphragms, that between 6 and 12 of them will get pregnant during that time period. And lastly, I'm going to cover the most effective way to prevent unintended pregnancy, and this is known as voluntary reversible long-acting contraception. And here I'm talking about implants or intrauterine devices. There's a little misunderstanding about intrauterine devices. They're very safe, very effective, and you can have them taken out and get pregnant down the road. So they're not permanent. The pregnancy rate for implants and intrauterine devices are less than 1 per 100 women in a 1-year time period. That means if we have 100 couples that are using either an implant or an IUD, less than 1 will get pregnant every year. And I would be remiss if I didn't talk about permanent sterilization, which is not what we're advocating at all, but they are available. One is tubal ligation or hysterectomy. That's for females. And for males, permanent sterilization would be a vasectomy. These are long-term and irreversible and should not be entertained if you have any thoughts of wanting to have a child in the future. So as you can see, different forms of contraception or prevention of unintended pregnancy have different rates of effectiveness. You need to make sure that you know what is best for you and the situation that you're in. We don't advocate for any of them over another one. We just want you to be aware of the risk should you get pregnant and be taking medication for opioid use disorder. We've talked about the different forms of contraception or prevention of unintended pregnancy, from the least effective to the most effective. And it can be very confusing. It can be very difficult sometimes to figure out which is the right one for you and your situation. I'd like to make you aware of a resource provided by the Tennessee Department of Health that's available through telehealth. Telehealth is wonderful. It's not as time demanding. Get your appointment sooner. It's convenient. And of course, there's a privacy with just you and the provider. This service is a service revolving around family planning, and you simply need to call 1-833-690-0223. Again, that's 1-833-690-0223. And as always, if you have any questions, please feel free to reach out to me here at Cedar Recovery, Dr. Stephen Loyd. Thank you.